to invite Dr. Sankha Subhra.
Sankha Subhra CHAUDHURI.
He is going to present on surgical outcomes of a novel Staphyloma repair technique using filamentous knitted polyester fabric.
Good morning, respected judges, moderators, and the delegates. I am Sankha Subhra CHAUDHURI, here to present on our work the surgical outcomes of a novel Staphyloma repair technique using the filamentous knitted polyester fabric. We have no financial interest. As we all know, that the sclera is the outermost covering of the eye, and it provides a structural support to the eyeball. As a consequence of trauma or surgery or glaucoma or various immunological reaction, sometimes the sclera support is weakened and there is protrusion of the eyeball with an underlying uveal tissue known as a staphyloma. If a proper tectonic support is not given to the staphyloma in time, then over a period of time, it may lead to perforation, which may cause devastating sight-threatening complications. In our study, which is a 6-month study done in the Orbit and Oculoplastic Clinic of RIO, Kolkata, 4 cases were taken with a prospective interventional case study. The surgical technique we are showing that at first, meticulously the conjunctiva is dissected, as you can show, then the intercalary staphyloma is being exposed, and over it the filamentous knitted polyester fabric is placed with 80 polygalactic sutures. It is well anchored to the healthy sclera that is around it. And then over it the conjunctiva is secured with interrupted sutures. And you can again see the staphyloma is exposed, the fabric is placed, sutured with the healthy sclera, and then the conjunctiva is covered. Now all the 4 patients underwent successful repair. The IOP was well controlled with IOP lowering agents. None of the patients required a resuturing or a regrafting, and after 6 months of follow-up, there was no recurrence, hypersensitivity or rejection, and all the patients had a stable vision also. Now you can see the preoperative pictures with the intercalary staphyloma and the postoperative pictures after the application of the filamentous knitted polyester fabric. Irrespective of whatever the etiology may be, which causes staphyloma, there are various techniques that has been used for the tectonic covering, with maybe autologous tissues like the periosteum, fascia lata, cartilage or cadaveric tissues, or commonly the synthetic materials like the Gore-Tex. But the outcomes of all these materials are very variable. That is not predictable. There are incidents of graft rejection, dislocation, infection, and necrosis. And sometimes there is also postoperative vision drop is noted. So here we are to advocate the use of filamentous knitted polyester fabric for a staphyloma repair technique because it is readily available, inert, toxic, and cheap. It does not cause any immunological reactions. And we can also bypass the steps of the graft harvesting as it is needed for cadaveric tissues. And at 6 months follow-up, there was no recurrence of staphyloma or a repeat grafting is needed. The filamentous polyester, so the take-home message is the fabric have shown a great tensile strength and long-term durability. All the patients have expressed their satisfaction with their postoperative cosmetic, functional, and structural outcomes. And the material is readily available, non-immunogenic, and shows a great promise as an alternative to donor sclera graft in staphyloma repair. Thank you.
Your follow-up is only 6 months. And
Doctor,
cases are only 4 cases, no?
We have done till now 4 cases.
you have done very few numbers, and have you done any comparison between the patch grafts, which homologous scleral patch grafts or any?
Yes, so we have done previously scleral patch graft because it is already been done, but for this study with the outcome we have not done any comparison.
No comparison.
And all the data we have, the meta-analysis data that are available.
6 months is a very short period to comment upon whether it's a successful graft or not.
Okay.
And how posterior have you been able to
Posterior staphyloma.
Yeah.
No, sir, we have not included
You
posterior.
have only included anterior
anterior
staphyloma.
staphyloma, integrally staphyloma.
Okay. Thank you.
And what is the source of your material? Where
So actually the material is already been used for years in cardiology CTVS department.
it's readily available?
It is hospital supply material. So they are actually using for the graft if there is graft ectasia, they are using already the material. So we have taken the concept from them. Thank you.